Okay. So we have finished the 10 questions. So I'll just go through the answer briefly with you all. For the single best answer number 1, a 30-year-old lady just returned from overseas from a long haul flight. So the key point will be a long haul flight, okay, and presented with a left pleuritic chest pain, which is sudden onset in nature. So the most likely cause will be pulmonary embolism. Okay. So I think this one you all should just remember lah. Anything long, im prolonged immobilization, the first thing you need to think is pulmonary embolism. For question 2, a 56-year-old man with liver cirrhosis and portal hypertension presented with hematemesis. So when you have portal hypertension, you need to think of esophageal variceal bleed. So B will be the answer. And for question 3, a 36-year-old lady had progressive symmetric weakness since 3 weeks ago, and started from the feet and progressed to the hip upper limbs. And before that, she had diarrhea, which resolved. So examination, bilateral flaccid limb weakness, absence of reflexes, and plantar response, and normal sensory. So this one I think is quite clear-cut like Guillain-Barré syndrome. So if patient had any, AGE and then subsequently had weakness, neurological symptom, the first thing you need to think of is Guillain-Barré. For the transverse myelitis, usually it will be an upper motor neuron lesion. Guillain-Barré will give you a lower motor neuron findings. Okay. Multiple sclerosis, usually you don't get the diarrhea illness before that. Okay, for question 4, 25-year-old woman presented with 3 days of dysuria and painful knee joints. And she had diarrhea and crampy abdominal pain 3 weeks before that. Otherwise, she's normal, fit, not on any medication. The bilateral knee looks red, swollen, and warm. So this one diagnosis obviously is reactive arthritis. Okay, because you have the diarrhea 3 weeks before the onset of the knee pain and the swelling. So this is reactive arthritis. Rheumatoid arthritis usually is not associated with the diarrhea, and there will be stiffness, joint stiffness, and then they will usually prescribe like the pain or the stiffness tend to improve with activity. So that's something you need to watch. Septic arthritis usually not bilateral knee, usually it will be unilateral. Okay, for SBA 5, 70-year-old presents with a lesion over the cheek. It is raised, pearly border, and telangiectasia. So the likely diagnosis is basal cell carcinoma. Okay. So this one, when you see raised, the pearly border means it's a smooth, shining surface and a border. Telangiectasia, when you see like there is a superficial blood vessel seen over the surface. So this one usually point towards basal cell. If it's melanoma, usually it will be a pigmented lesion. Usually they'll come with they'll say something like pigmented lesion, which progressively increase in size, or the shape changes, or there is irregular pigmentation, or irregular border, or maybe sometimes it will give you an ulceration, then you think of melanoma. If squamous cell carcinoma, usually it will be more verrucous, more crusty, scaly, because it's at the superficial area, the squamous layers. So usually this one will not give you a smooth pearly border, and then usually don't have telangiectasia. It tend to be more like a fungating, fissuring, scaly kind of a lesion. Okay, moving on to multiple true false. So for the first question in the ECG, okay, it's recorded using 6 electrode. This one is wrong. I'm sure you all know already. V4 to V5 is recording the lateral, so not the interventricular septum. Normal axis negative 30 to positive 90 degree. This is true. ST depression is a specific sign. Okay, and BR interval recorded from the start of the P wave to the peak of R wave. This is wrong lah. Huh? Okay. Okay, so for question number 2, gouty arthritis. Okay, due to deposition of calcium pyrophosphate, this is false. Gout is due to uric acid. ESR raised in acute gout, this is true. Okay, in any inflammatory condition, regardless is infection or if it's due to autoimmune or it's due to inflammatory disease, it will always cause a raise of ESR. Joint radiograph show punch out erosion associated with soft tissue swelling. Okay, this is true as well. Positive bifringent crystal seen in polarized light microscopy. This is false. Okay, colchicine commonly cause diarrhea. This is true. So one of the things that when we are giving patient colchicine in acute gout is we look for the diarrhea. So once patient had diarrhea, we know it's cukup already, and then we will taper down the colchicine. Okay, regarding bacterial skin infection, impetigo is commonly caused by streptococcus. This is true. If they say if it's due to staphylococcus, it's also true. So streptococcus and staphylococcus are the commonest commensal on the skin that can easily cause an infection when there is a breakthrough. Okay, erysipelas usually present unilateral. This is also true. Anything infection usually tend to be unilateral. Cellulitis easily treated with penicillin. True. Okay, anything that is a penicillin group, it can be either Cloxa, Augmentin, Amoxi is going to help with the cellulitis. Okay, erythrasma could be diagnosed with Wood's light examination, which is also true. So if you shine a Wood's light on a pigmented lesion that is due to erythrasma, it will give you this coral red. It's like an orangey red kind of illumination from the erythrasma due to the corynebacterium. Treatment is with antibiotic like macrolides, like erythromycin. Okay, lupus pernio caused by TB. This is false. Okay, lupus pernio is due to sarcoidosis. Nephrotic syndrome is associated with an increase in infection. Yes. Okay, so usually this patient you cover with antibiotics. They can easily get SBP, subacute bacterial peritonitis, because of the ascites. And they had low serum triglyceride. This is wrong. Usually, nephrotic syndrome of the criteria is there's an increase in TG. Okay, low blood circulating blood volume. This is also true. So if the nephrotic syndrome, there is a leaking of your protein from the kidney out. So there will be a reduce in oncotic pressure. So albumin in the blood will be low, so reduce oncotic pressure. Therefore, there will be third space loss. The blood from the vessel will leak out into the third space. Therefore, the blood volume will be low. So your patient might look edematous, but intravascularly, they are depleted. Okay. So, and because of that, the blood tend to be more concentrated. There will be an increased risk of thrombosis. So, this type of patient we usually cover with anticoagulant for VTE prophylaxis, venous thromboembolism prophylaxis. And of course, they are associated with large kidneys. Okay, for asthma, PEFR is highest in the morning. It's false. Okay, morning usually cold air, there will be bronchoconstriction, so PFR usually will be low. Inflammatory cells are usually predominated by eosinophil. This is true. Silent chest is a sign of life-threatening exacerbation. So when there is already silent chest, patient is tired out, they can no longer they cannot, the ventilation part also will be compromised. So this is not moderate. Okay, so silent chest usually you really need to intubate already. Leukotriene antagonist is reserved for severe cases. False. And steroid is indicated during exacerbation. True. Okay, this one I think quite straightforward. Okay, I think that's the end for the 10 questions. Before we go on to Q&A, I just need you all to scan and help me to give me some feedback lah on this session. So hopefully anything that I did not cover during for this SBA and multiple true false, you all can give me some feedback and we can improve for the future session with the students. Okay, so I'll also send out the link for you all to give me the feedback. I'll send it through the team chat group. While we are waiting for the feedback, is there any question from the floor? You all got any question you want to ask?
Doctor, I want to ask about MTF. Is it have negative marking?
No. So usually, last time there used to be negative marking, but now I've already checked back with the organizer. No longer have negative marking. Even your single best answer also no negative. Previously, I had one question. They were asking me about whether during your exam, what will be covered for the SBA and multiple true false. It's just basically whatever that you have studied for the posting before that semester that will be coming out. So it might not be different. It might be different from other group because other group will be, some of you all might not finish off all the sub posting before the semester. So whatever that you all do, only that will be the one that's going to be assessed. Any other question? So I think you all will notice that between the SBA and multiple true false, multiple true false tend to take up more time. So if your SBA you think quite okay, then you quickly finish off and then give more time for your multiple true false, so that you have more time for the multiple true false lah. And the good thing, of course, no negative marking, so it's okay lah. If you want to, you're not sure you want the answer, it's not an issue. Any other question? Hold on, I will just I post up in the chat group the link lah if you all cannot scan. Hold on, I will just, while we waiting for any further question, I will download the attendance. Okay, if there's no question, or you are quite shy to ask, you all can just put it into the feedback, and if I have time, I will just reply it to one of your representative, and then you all can and I can follow up through there. Okay, so the next, I think next week we have a session. That one we will be cancelling because we have already covered 2-in-1 in this session. But in case you all have any you want another session, you want to discuss anything, you all can just ask one of your representative to contact me, and then maybe we will see lah when can we meet up and discuss. Okay, if there's no question, I think we can end this session. Thank you everyone, and good luck for your exams.